Welcome to Startup Health TV. This is a health innovation update. I'm Logan Plaster, editor-in-chief of Startup Health magazine, and I am lucky to be here today with Sumeet Maniar, a CEO and co-founder of WellBrain, and Dr. Ruben Kalra, co-founder and chief medical officer at WellBrain. Gentlemen, thank you for joining me for this update.
Yeah, thank you.
So the way that we are running this show is we're really talking to entrepreneurs about how they are refocusing or reframing their offering in the midst of the coronavirus. So I understand that you're working in the realm of pain management. WellBrain is doing some very interesting work. So why don't you first just sort of frame the offering and your product, and then we'll talk about kind of how you're pivoting or focusing right now.
Yeah, I'll start first and then I'll have Ruben join in. But we are a digital health chronic pain management platform, and we're working with physicians and hospital systems to leverage this platform, specifically using evidence-based non-opioid modalities, such as guided meditations and other types of solutions to help patients alleviate their pain and other factors. A large component of this is anxiety, depression, and other parameters that physicians look at. And so we have a benefit of working with three co-founding pain physicians. One of them is Dr. Ruben Kalra, and we use this as a living laboratory, not only to generate products and solutions to the market, but right in the midst of this, in this COVID situation, we've adapted some of our solutions, and we've done it on a dime practically, and Ruben can highlight some of those solutions we've worked on, which is being live from a physician perspective and what's happening from that aspect. Ruben?
Yeah, absolutely. I mean, this incipiency of WellBrain started maybe about 4 years ago. We are a team of practicing chronic pain doctors in Northern California. We see about 30,000 patient visits a year. And about 4 years ago, we just started seeing a lot of patients who were coming to our office who wanted opiates for all the wrong reasons, maybe for anxiety, insomnia, addiction. And at the time, and still now, there just weren't a lot of great offerings where patients maybe didn't want to go see a psychologist, or a psychologist didn't take insurance. And so we created a platform using objective psychological tests and essentially gave it to our patients and gave them a guided meditation afterwards that was personalized. And we started seeing our own patients getting better. So we decided to go out to a conference, as most doctors do, and share what we found. And the initial response was, well, patients don't want mindful meditation. They want OxyContin. Fast forward the opiate epidemic, we become integrated in numerous practices.
You may have to translate. You may have to translate some solution.
Fast forward COVID. Oh, can you hear me?
Oh,
your internet connection slowed down a little bit, but I guess
you were breaking up. You were talking about going to taking your research to conferences and getting some pushback, and then having the opioid crisis kind of bring everything into relief.
Yeah, so when the opioid crisis came to play, then we were sort of in a good position, just because a lot of practices realized that we have a solution to help patients that needs to be addressed. Because surprisingly, at the time when we started, I would say about 98% of doctors just weren't asking their patients if they had anxiety or depression or addiction. And now that's become increasingly salient as we understand the complexities of chronic pain. And fast forward to COVID-19, Sumeet and the team were able to launch a telehealth product to address brain health. And we've seen unprecedented growth just in the past few weeks, where practices are adopting our platform because mental health issues have increased, probably 1,000%. We see it with our own patients, and they're really grateful for having the product. In addition, since our platform can be reimbursable for clinicians, we've seen a lot of adoption, just because a lot of clinicians are also small businesses suffering, and they're looking to adopt a platform that can help their patients and help their practice as well.
Okay, so Sumeet, why don't you break that new platform down for us? What is it that you've been developing over the last month?
So in the last month, 3 initiatives. One of the things is, because of this COVID situation, we've enabled specifically our solution has been enabled for physicians to monitor patients at home through some new codes the CMS has put out, and that actively enables the practice to engage with the patient at home. So we were designed for that. So now with this COVID thing, the physician is now at home as well, and they can do some of these parameters. So some of the specifics, what we did was we automated that solution, because we're B2B to C. We're an iPad app in the clinical or medical setting or in the hospital setting, but obviously not everyone can touch and utilize that iPad.
Mm-hmm.
So we've quickly came up with a workaround that enables some of the functionality of the feedback and the inputs that physicians need to collect from patients and automate that process. So now ahead of time, patients can answer these questions on their movement, their anxiety, their depression, and then the physician and his or her staff can interpret that and schedule a Skype call and then actually treat the patient. The second thing, what we're doing is we're enabling our whole mindfulness component available to be free for almost anyone and everyone. And we even have physician burnout modules and healthcare worker modules. So we have all these different modules. Modules are like series of chapters in a book that patients can segue themselves through, whether it's anxiety, depression, what have you not. So we have one on, I think, healthcare worker, anxiety and depression and those type of issues. So those are the two components we're enabling.
Talk me through a typical patient experience. If I'm struggling with anxiety because of COVID-19 and my healthcare provider has WellBrain, and so I communicate with them over email or I call them on the phone, they say, hey, let's interact through this platform. What is my actual experience of the product?
I'll comment a little and then Ruben can say it from the physician perspective. So literally the experience is you can either call the physician or engage with the physician. The physician will send you a link or a text, the actual text, and then through that text and link, it's a secure, HIPAA secure questions and answers that you as a patient can give the feedback of how you're feeling. And these are using some standardized methodologies. And then that input is translated into a bunch of graphs that physicians track longitudinally. And then the physician use that as a device to provide the right course of action. Right, Ruben?
So my email, am I emailing, texting? Am I doing this every day? How does it work?
Ruben, you want to handle it?
Yeah, sure. I'll take it just because, we're one of the many practices using WellBrain and, as clinicians, we're really busy and we want to have integrate platforms that are seamless for our operational flow. So the way that it works for us is, we're primarily doing a couple thousand telehealth visits a month. So prior to any visit, the patient gets their, and we're using Zoom, so they get their Zoom ID and code. And also as part of it, they have their patient intake form, which is pretty standard practice, which includes the WellBrain questionnaire, which will address questions on anxiety, depression, catastrophizing, insomnia. And as soon as the patient comes in for a visit, we actually look at those results and can set up time to discuss those issues. In addition, for patients, let's say they haven't come in, we're getting these automated reports on a weekly basis so we can schedule appointments if patients are, seeing an increase in depression or anxiety. Because the cool thing about the platform, it's not just a stamp in time. Usually patients come in, you only have a snapshot of a visit about what's going on. But with our platform, I get a sheet looking at their trend of medication use over time, their anxiety and depression over time, or their pain. So if I see an uptick, there's automatically an alert. And even our practice, we've seen such a dramatic uptick that we've decided to offer mindful meditation classes remotely through Zoom for a lot of our patients. And that was just something because we saw the dramatic increase in anxiety, depression, and insomnia from a lot of our patients.
So if I'm a patient, I'm suffering from anxiety because of COVID, I'm guessing I'm getting automated alerts to continually fill out information about myself so that you get this user-generated data about tracking my well-being. And then how do these guided, you said meditations, how does that sort of therapeutic side play into this?
So, to answer your question, it's on a monthly basis, but it could be modified every month. We're checking in automated on their brain health. And for those patients where it's a little more concerning, we may try to engage them a little bit further. If it's severe anxiety, depression, we actually, will set up an appointment with them to go over the results and maybe try to get them additional resources that in the background, I don't know if Sumeet wants to talk about it, but we're partnering with a telehealth company to help provide some of those services like cognitive behavioral therapy remotely and other psychological support.
Yeah. So one of the last, the patient experience is actually quite robust in the sense that one of the other parameters we're introducing this week, as soon as we get it released on the app stores weekly, how do they feel in their pain, mood, and sleep? And then additional add-on we've partnered with, because many physicians, we're not just limited to pain physicians, it's where pain manifests itself or the emotional health. And we're incorporating a telepsych service, if you will, because there's a tremendous shortage of psychologists across the country, not psychiatrists, psychologists. And if a physician notices someone who has strayed high for severe depression, severe anxiety, they can click on a button, and then that patient can fill in an additional intake form and then have a counseling session with a psychologist within 4 days. So that's the KPI turnaround that we're looking to integrate, and which is quite fast, because otherwise, if you try to see a psychologist right now, it's usually several months to see one. So that's another part of the puzzle we're, evolving into this COVID environment.
Yeah, and I don't want to jump in too much, but yeah, one other thing besides, we're definitely helping patients, we're definitely helping providers, is we also have partners that promote the use of non-opiate modalities, such as spinal cord stimulation. And a lot of these companies are challenged without having a digital strategy right now. And in chronic pain, we've had stakes in the ground for 4 years. We know digital extraordinarily well. I mean, we were able to implement a telehealth platform in pretty much less than a week. And for a lot of these device companies, their reps are not allowed in the offices. It's going to be unclear what the take is going to be until a vaccine's developed in 12 to 24 months. But a lot of these partners are extraordinarily intrigued by our ability to help increase access to their technologies through a remote platform and share it with their teams, so that these companies can follow up on these patients, assuming patient and clinician approval. But we're pretty optimistic. We have a great strategy for not only helping patients and providers, but also our clinical partners who are developing helpful tools that are non-opiate modalities.
Gotcha. So since WellBrain is gathering and tracking all of this longitudinal data around mental health, anxiety, depression right now, I'm curious what some of your global trends are that you're noticing just around the coronavirus. Just what are some of the mental health concerns you're seeing, things that concern you, things that might have surprised you? What's on your radar?
We haven't necessarily sliced and diced the data yet. What I can tell you
It is early.
Yeah, it is a bit early, but we are going to. I can tell you from looking at the reports on a consistent basis in our own practice, which is a pretty big practice, we have seen probably, I would say, a 10-fold increase in anxiety and depression, probably a 5-fold increase in insomnia.
You broke up there,
And
Ruben.
then more than anything else, I'm always one of
You said, sorry, you broke up. You said, I heard 10-fold increase in anxiety and depression, and then 5-fold increase in blank. Go ahead.
Oh, in insomnia.
Okay.
And the nicer thing is that I'm one of those clinicians who like to engage my patients to teach them how to fish. And a lot of my patients were hesitant about engaging in meditation because they say they can't do it. And this is, we've had almost a 10-fold increase in patients wanting to engage in mindful meditation. One, because they realize it's a really helpful tool because everyone's feeling rather overwhelmed. And two, folks are at home, so there's really no excuse not to try to engage in it.
Sumeet, how do you distinguish yourself in the meditation market, since it's becoming a crowded field in digital health?
Yeah, interesting enough, some of those bigger players had approached us for acquisition. We are more on the medically focused. So we're entirely, all our input comes from our founding physicians and our 10 physician scientific advisory board. So we see how those market dynamics work out in that realm and then apply it all the way to the C. So we don't want to compete with all those mindfulness apps, but what we are doing is bolting it on with all these assessments. And then eventually we're going to do data mining and deep learning to see what type of patients are using what. So yes, to answer your question, we might see these type of pain patients, and we'll see the trend line using depression modules in our thing, or using anxiety modules or sleep. Interesting, we used to be very prescriptive, if you will. And what we found out, all the patients wanted access to everything. So now we're doing reverse learning to see that, because in this time, especially patients, it's like, I want the sleep module, I want this module. Before, we used to have them unlock each module as they completed or as the physician deemed necessary, but now it's turned itself on its head, where it's now, on that aspect, it's consumer driven. So we don't want to compete with those other mindfulness modules, but where it's used in the clinical setting in conjunction with the physician assessment, that's a unique selling proposition. And that's where we can work well with hospitals and other systems along those
Yeah,
lines.
and just to answer further on that, I don't necessarily see our competitors Headspace or Calm. We see our competitors more like Livongo and Omada, and those folks focusing on the digital health space, because we are primarily focused with clinician offices, and it's been a platform. We're happy to partner with Headspace, Calm. We just want to be able to optimize offerings for all of our patients. Whether they use WellBrain or Calm or Headspace, if they use it, that's terrific. But I think in the grand scheme of things, in the long run, we're going to have a very robust platform that just does not only integrates mindful meditation, but other components like physical therapy, and using machine learning and AI. It'll be awesome for me, where essentially this data is going to be helpful to make decision-making for patients, where an example, a patient comes in, has severe right low back pain for 5 years, has tried 3 different treatments. And then we look at our database and go, wow, there's 30 other patients just like this patient. And these 5 patients had successful outcomes. We can use the machine learning and AI to help provide some recommendations for those patients, especially in a digital environment.
Gotcha. Shifting gears very slightly, I know you are both passionate about really fighting the opioid epidemic and fighting back opioid dependency. And that's really a big part of WellBrain from the beginning. And one of the themes that we're seeing in these health innovation updates is talking about areas of chronic disease, et cetera, that are they're going to be impacted down the road by the intense focus of COVID-19. And I'm wondering if you have a perspective or thoughts on kind of how folks who are suffering with opioid dependency are suffering right now, and kind of what some of those secondary challenges are going to be involving the opioid crisis as we come out of this.
Well, I think a couple of points. One of the things is we always started out being mission driven. And one of the components of being mission driven, we want to help out those communities of need. And Ruben can attune to this. He gets calls from state health commissioners all around, but all across the country, we get inbound requests from patients. And right now, our mindfulness and all those other components are free if they access the physician. That's why we're going to make it publicly available to anyone and everyone, because we're just seeing so much inbound demand for that. And we always wanted to do it. We just didn't have enough resources to do it. I will say AWS has helped out and said we'll pay for all the bandwidth once you scale up when you offer this free. I wish I had it out like 3 weeks ago, but we can only do so much in such a short time frame. But yeah, to answer some of your questions, there are a lot of initiatives in healthcare clinics or county clinics that need help, and we can give them the software for free to use because it's scalable, and that's the initial plan. And Ruben, you want to add a bit on that?
Yeah. I mean, to answer your question, Logan, yeah, I mean, it's been extraordinarily challenging for a lot of pain patients, just because, a lot of times they can't see their clinicians. Some patients are having difficulty getting their pain medications. And as a consequence, they're hurting. And if we look at chronic pain patients, there's a significant portion of the population that already suffers from anxiety and depression. And COVID-19's already exacerbated that. So I think you're going to see it out there. Historically, after financial crises or pandemics, there is addiction crises, alcohol abuse, drug abuse. And so we need to be even more vigilant and more aggressive in addressing these challenges. Fortunately, the groundwork's been laid by a lot of states mandating the psychological testing that we do. We just need to make sure that we're focusing on our patients and taking care of them during this challenging time. And WellBrain helps clinicians do that.
Awesome. Well, I think that's a good note to end on. Sumeet, if someone wants to partner with you, what's the best way to reach out?
Yeah, my email, which is easy, well, Sumeet, SUMEET at wellbrain, one word, .io.
Awesome.
Or, yep, that's it.
Awesome. All right, guys. Well, love hearing what you're working on, and more importantly, just appreciate that you keep striving in this time to help people in the ways that you do. So thank you, and stay healthy.